Welcome to Upstream University. In this video series, we will team up with some of the mental health community's most respected experts to explore effective and often new and innovative ways to address issues before they become serious mental health challenges. Together, we will travel upstream to understand ways in which we can reduce risks and increase resiliency, and to identify early signs of mental health needs when services and support can more effectively enable recovery. Today, we will discuss the challenges that come with promoting mental wellness and take a look at how technology can increase the spread of mental health information to those in need.
Hello, my name is Ricardo Muñoz. I'm a professor of clinical psychology at Palo Alto University and professor emeritus at the University of California, San Francisco, in the Department of Psychiatry at San Francisco General Hospital. What I want to talk about today is the potential of digital interventions to help to administer preventive and early intervention services to people throughout the population. I began to work in the area of prevention in 1972. My first publication was in 1975 called Prevention of Mental Disorders. But as late as 1984, the state of the science was such that NIMH was able to publish a report that said that major depression cannot be prevented. Now, since then, my colleagues and I have done work to show that, in fact, major depression can be prevented. And the National Academies of Science, Engineering, and Medicine have had now 3 consensus reports in which they've reviewed the literature and agreed that not only can certain mental disorders be prevented now, but we can also move toward promotion in the area of mental health. In 2019, the National Academies published a report on prevention and promotion in which they made the point that what we need to do now is to implement what we know. The National Academies suggests that in addition to treatment, we should be doing prevention and promotion. Now, how to scale these interventions is, of course, a large problem. I began doing work in this area back in the 1990s. In 1997, I published with colleagues of mine a study in which we showed that we could help people to quit smoking. And it occurred to me that if we could do that through the mail, we could also do this through this new tool called the World Wide Web, which had just come online in the early 1990s. So what we wanted to do was to see whether we could match the patch, the nicotine patch. So we looked at studies that had used the patch to help people quit smoking, and we found that people who used the placebo patch had only a quit rate of about 4 to 8%, but if they used the patch, the quit rate went up to 14 to 22%. So we set that as our goal, and in fact we were able to do that. But what was really remarkable was that from San Francisco General Hospital, we were able to reach people throughout the country. So this is what led me to think about the idea of what we call massive open online interventions, similar to massive open online courses or MOOCs, which are provided usually free of charge to anyone in the world. We should be doing the same thing with health interventions. One of the major issues that this would help with is cost. In our last study, we had about 19,000 people come to our website. And the reason for this is that as more people use the site, the marginal cost, which is the cost of giving the intervention to one more person, eventually approximates, although it never quite gets to 0. So that's why we are now recommending that we should be developing digital apothecaries. Digital apothecaries would be online repositories of massive open online interventions that people could come to and be able to take an intervention right from the website or from an app. At times, when there's a lot of stress, for example, during the COVID pandemic, the stress can bring our mood down until we cross threshold into a clinical depression, in which case we need treatment to get back to normal functioning. Instead of waiting until one crosses that threshold, we should be doing something preventively. We should be teaching people the kinds of things to do, for example, to get their mood level back up to a normal mood. Do these things actually work? There are now studies showing that, in fact, that they can also be used to prevent new cases of major depression. Ideally, what we would be doing is blanketing with these massive open online interventions, which would be available anywhere. The idea would be to have digital apothecaries that are systematically filling in a grid so that these interventions could be developed, tested, and disseminated to as many people as need them. So what digital apothecaries could do is 4 things. The first 2 would be helping to provide more face-to-face interventions. The second thing that could help providers would be to give them adjuncts, such as websites or apps that they could share with the people they're helping. And then there would be 2 other things that digital apothecaries could provide, and those are self-administered interventions. And the 4th one would be actual helpers, like quit lines, in which people who are using these apps or these websites would be able to hit maybe a chat button and they would have access to someone who could help them. So that's how digital apothecaries could help to increase our ability to disseminate preventive and early intervention services to all who need it. Thank you.